Hi, only too often we talk about ADHD to each other, to parents, to doctors, to therapists, to teachers. But how about talking to your child? And I think it's such an important part of the communication and the ability to help your child understand exactly why they're taking this medication, why they're going to extra therapy, why they need extra meetings, why they're visiting the doctor. And as a pediatrician dealing with children with ADHD, I really try and make a point of trying to communicate and help children understand. Obviously, from a parent's point of view, and in the beginning, it's a learning curve for all of us. Parents need to understand what is ADHD. Because unless you understand yourself, how do you communicate with your child? And over the last week, I've been chatting to a few of my patients at the end of the year now. We're doing assessments and asking them about their reports, how they're doing, are they taking their medication? And, I often feel that a lot of kids don't understand why this is happening. It's like taking a child into a doctor's room and just giving them injections, vaccination, without helping them understand what is the reason and the benefits. But, if you bring a child in and you explain to them why it's important to get an injection, why it's important to get vaccinated, to protect them, to help them not getting sick, and also help them not making other people sick. It's amazing that insight, how a child gets it, and I think we've got to try and have that mentality and mindset about any condition. If your child had diabetes, you'd be explaining to them why and they need this medication, or why they need to eat healthy, why they've got to do X, Y, and Z. So I'm just going to go through some tips that I feel is vital in helping you communicate with your child. Because a couple of kids have said to me, I don't want to take the medicine on the weekends, at the holidays. I'm not at school. I don't need the medicine. Can you see that this is a negativity, particularly the older children get in adolescence? There's a lot of negativity. So I'm going to help you understand and help you communicate, and that way we're going to increase children's compliance, taking their medication, buy-in, helping them understand, take ownership, because the more they understand, the more they can help change their behavior. Only too often we do things, we kind of a top-down approach to kids. So this is my approach to helping you understand some of the things that we should think about. First of all, we need to have an idea as to how do you communicate with a child what is ADHD. I simply say to children, do you know anybody in your class that wears glasses, that wears spectacles? They often say yes. They often have a parent or a sibling. They might be wearing glasses themselves. So why do you wear glasses? And often they say, well, so I can see better. Those kids who need glasses in class, they need to be able to see the board, the whiteboard, the teacher. They need to be able to see clearly. You see, treatment for ADHD and ADHD is like wearing glasses. It's glasses for the brain. It helps the brain think clearly. That often is a starting point, because it is sort of, I suppose, physiologically correct in saying so. And then what is ADHD? I try and help them saying that the brain's brakes are not working as well. The brain is a very, very good fast car. It's a sports car, but unfortunately, it has the wrong brakes. And then managing ADHD is like giving the right brakes. It's helping control your emotions, your thoughts, your concentration, your memory, being self-aware, listening. So there we get an idea as to why it's important to take the medication every day, not just at school days. So, the next thing is, what is the treatment of ADHD? And it's like brake fluid for the brain. It is brain's brake fluid. And I'll give an idea as to how the brain and how children with ADHD, if they're not taking medication, they make their own brake fluid. And they often eat sweets. They get sugar cravings because it releases the same chemicals in the brain, which is not so good because it also has other impact. Makes kids hyper, makes them have brain fog later on. And then, of course, watching devices and screens is like a dopamine hit. They get addicted to it. They are treating themselves. And, of course, sports and exercise, which is healthy. So then, of course, there's medication. Medication is the way It helps control the brain, become less anxious, more calmer. The braking system is starting to work. And that way we can unlock what we call the executive functions. That powerful sports car brain can kick into action and start to really kind of be active. So, if you have a good communication with your child, it's like any discipline. If you've got to discipline your child, you've got to tell them something, you want to get them to something, you want to get them something to do, then what you want them to do exactly your instructions, carry out your instructions. You've got to have a good relationship. No matter how dictatorial or how you say it and how you try and discipline a child or get them to do things, unless you have a good relationship, it's not going to work. So you also need to have a clear understanding of ADHD. I've got a lot of information on my website, the Facebook group. Try and make sure that you have a greater understanding, because how do you explain to your child if you don't have a clear understanding yourself? And also, you've got to make sure that your child knows that they are loved unconditionally. This is not a problem that is, if you don't take your medicine, you won't be loved, you won't get the support. It's very important that, a child understands that this is not an intelligence problem. They don't have anything wrong with their ability. It's really not a problem from that point of view. It is the way the brain is controlled. They've got to learn control, the whole braking system, the glasses for the brain to help see clearly. It's important that they think about changing some behavior, which you can tell them about, but also taking their medication is an important start. And you've got to pick the right time. It's no good when a child's busy doing other things and you're trying to communicate. You've got to pick the right moment. Sometimes you've got to wait a while. Wait until they ask questions. When a child starts to ask questions, particularly older adolescents, they on Google, they're wanting to understand the medication, they even understand the side effects of the medicine. They'll end up asking you questions. So maybe that might be a good starting point. And then also you need to let your child know that it's the ADHD that you're going to help them with. It's not they have a problem and they've got to deal with that on their own. The ADHD is something that you're going to help them deal with on their own. Often in the family, there are other people with ADHD. Often a child will say, in our family, I'm very much like my dad or my mum. We are a bit disorganized, we need help, or we a family that are very loud. We kind of all have the same sort of kind of issue. And it's something that as a family, if you understand, talk about it, you're able to then kind of manage it together. It's a collaborative approach. And often then a child feels inclusive, in being able to be more successful in managing it. So don't expect your child just to sort of get it and have an amazing interest or amazing sort of kind of Rubicon moment in their lives that they sort of get it and they sort of this veil of understanding is suddenly brought forward and they suddenly are interested. They're going to take a bit of time. They might find it a bit frightening. They try to even ignore these things because they know there's a problem at school. They know there's a problem at home. They know they're on medication. And yet, they might sort of kind of be playing it a bit cool. They don't really want to show immediate enthusiasm, depending on the personality of the child. So be persistent. Don't be put off if they're not that interested in the beginning. And, to learn more about ADHD is the most important intervention that you can help for your child. When I do assessments, I talk about things, I try and help parents understand. The most important thing that you can do is understand what it is, what it isn't. And then you can communicate that with your child. Because if you understand what it is, then you know how to manage it. And then your child also has a clarity about what to do. So, connect, forums, groups, connect, ask your doctor. I've got even some podcasts, I've got audiobooks that I can suggest. It makes a big difference. Don't focus on the negative. Children with ADHD have a lot more instructions. Parents have got to say this, don't do this, do this, start this, stop that, keep quiet, don't interrupt, give other people a chance to talk, get down with your homework. There's so many negative kind of instructions. So don't try and associate the problems with ADHD with ADHD. You know, it's important to focus on the accomplishments. You know, they're good at sport, they're creative, they're friendly, they've got a good sense of right and wrong, they've got energy, they've got motivation in some ways. So help focus on those important things they're good at, because then it leads, it's like a foot in the door, it's leverage to help deal with the issues related to ADHD. And when they do something right, praise them immediately, give immediate feedback. They need that encouragement because their lives are so full of negativity, particularly at school or even at home or from family and friends. And the other thing is, don't let a child use the ADHD as an excuse. You know, I've got ADHD, I forgot, I don't want to, it's not my fault. I forgot to take my medicine. I'm on medication. It's not my fault. So that is something we've got to eradicate. You know, we've got to give them the right to help, but they've got to take ownership. They've got to realize that the only way to overcome is a kind of a combination of things. They've got to listen, they've got to take their medicine, they've got to exercise, eat, sleep. They've got to be able to do their bit, get organized. So we've got to sort of shift that very fine dividing line between a problem and just absolving yourself that it's not my problem. And I think that's an important way just to strike that balance. You know, talk about the medication, because sometimes children take medicine that makes them feel unwell. It doesn't make me feel good, get a headache, stomach ache, I don't want to eat, I don't feel so good. And that's about communication. Unless we talk about what the problems are, you won't know what the problems related to the side effects, because they might not necessarily tell you. So I think, you know, if a child is having side effects, they're not going to want to take their medicine. And often if a parent is negative about the medicine and they're talking about it, you know, this is going to impact a child's kind of attitude. So what I would say is, the more we know, the more we can do. You can adjust medicine, you can change the medicine, you can take it at different times. You can kind of go from long acting to short acting. Every child's different. So this is important about communicating the language of managing, making your child have a rich, holistic life and not be necessarily kind of sort of tortured by a condition that they think they have with medication that doesn't make them feel good. It's not going to be a good combination. The older they get, they're going to resist it. So I hope this helps you, give you an overall as to how to communicate. Maybe you'd like to share your experiences in the group. How do you communicate? Do you have any tips? Are there any things that you've used to help your child understand? What are the sort of questions they ask? We'd be very, very happy to hear about that.